Hello, my name is Srinivasa Kishore. I'm the Chief ENT and Sleep Apnea Head and Neck Surgeon here at Star Hospitals in Hyderabad. What is turbinoplasty? So in order to understand what is turbinoplasty, we need to know what is turbinate. Turbinates are 3 in number in every human being's nose. Not only in human beings, they are also in animals. Now, turbinates are actually bones over which there is a soft tissue cover. Now, turbinates actually have very important functions. The first most important function is to actually give immunity and develop immunity in the nose, number 1. Number 2, once air goes into the nose, it hits these structures called turbinates, and a smooth flow of air becomes what we call as eddy currents. These eddy currents can reach the uppermost part of the nose where the olfactory nerves, that is the nerves for smell, are present. The third most important thing is that these turbinates have lot of blood vessels and glands which basically cool the air that is going in or heat up the air going in. So in other words, these are our air conditioners of the body. Supposing you are in a desert of 50 degrees centigrade, and if you take in that air of 50 degrees centigrade into your lung will pop just like a popcorn. So in order to regulate the temperature going into the lung, the turbinates work. So these 3 are the main important functions of the turbinate. Now, but sometimes because of certain diseases, these tissues swell in size. If these swell in size, they cause significant obstruction to the free flow of air. This causes the patient or a person to have significant problems while he is breathing. His quality of sleep would go down. His daytime concentration goes down because he is obviously not being able to breathe properly. So in order to control these symptoms, we do procedures called turbinoplasty. Now earlier we used to do procedures called turbinectomies, wherein we used to cut off these structures. Especially if you are in a dry area, these turbinectomies would cause a condition called empty nose syndrome. So we don't do that anymore. Nowadays we use radiofrequency or we use mechanized tools or laser to shrink the size of these turbinates, and that is what is called as turbinoplasty. Thank you.